Thank you very much, Mary Ellen. Good morning, ladies and gentlemen. Greetings from the 6 Asian National Alliances whose stories I'll be sharing today, as well as our Global Secretariat. Everybody contributed into this presentation. Every day, 1,000 girls and women die needlessly in pregnancy and childbirth. Almost all of them are in the developing world. This has been going on for far too long, yet together we can put an end to it. The White Ribbon Alliance is a global movement with members uniting to push for change so that all women and newborns in every country have the life-saving skilled care which is their right. We're making remarkable progress, but we still have a long way to go. In some cultures, white symbolizes mourning. In others, it symbolizes hope and life. Our white ribbon is dedicated to the memory of all women and girls who died needlessly in pregnancy and childbirth. We unite in hope that we will play our part in making sure not another woman dies this needless death. Our international coalition is now over 150 countries strong, with national secretariats in 15 countries. For the past decade, our rapidly growing network of individual members and organizations have been amplifying the voice of women and their communities. We would like to believe that we're a leader among those holding governments and institutions to account for the scandal of maternal mortality. White Ribbon Alliance is a grassroots movement that builds alliances, strengthens capacity, influences policies, harnesses resources, and inspires action to save the lives of women and newborns around the world. The White Ribbon Alliance is united by our common goal to make pregnancy and childbirth safe for all mothers and newborns around the world. We're guided by a shared strategic plan and global advocacy objectives to which national alliances work towards. These are governments held to account to improve maternal health, health workers better supported to provide care for women, a standard established for respectful maternity care, rights realized for girls and women, a strengthened alliance. However, national alliances also have an autonomy to determine our own priorities at the national and subnational level. We contribute to and work towards the global objectives, but the focus and national objectives vary across national alliances. Though the focus of objectives vary from alliance to alliance, most of our objectives can be grouped into 4 categories: pushing for the right policies to be put in place, demanding sufficient resources for health, and specifically maternal health and health workers, accountability efforts, ensuring that commitments are delivered and implemented, and finally, ensuring that girls and women have the information they need to demand a safe pregnancy and childbirth. Now, I would like to share with you the stories from the 6 national secretariats. Very aptly, we start with Nepal. Nepal is our earliest example of the alliance, the way we work. White Ribbon Alliance Nepal started raising voice and making safe motherhood a national issue when it was not on anyone's horizon. This is way back in 1996. Other than that, White Ribbon Alliance National Secretariat in Nepal has been working for years to advocate for a bill that would institutionalize the improvement that's needed to save the lives of women and babies. This bill includes women's right to make decisions about their own health, improved and accessible health services, effective emergency referral systems, and free delivery care. The National Alliance has been working closely with the government to draft this bill and as a liaison with the civil society to gain feedback through the process. This bill is expected to pass the Parliament this year. Safe Motherhood Network Federation is already planning district-level meetings with members to inform them about the bill. They also would like to share that keeping the pressure on the government and donors to continue to work in this issue and creating a large network of active NGO volunteers is indeed another of their successes. When we talk about the challenges, you'll see there are some challenges that cuts across all the national secretariats. For Nepal, these are lack of secretariat support, lack of funds to train members on technical issues, political instability. Similarly, in Yemen, we have another example of pushing for the right policies, where White Ribbon Alliance's National Secretariat in Yemen, the National Safe Motherhood Alliance, has been campaigning for a safe age of marriage bill, aiming for legislation which will make child marriage illegal in their country. They've also developed a film, Upcoming Hope, with the Midwifery Association in their country, which talks about the 4-delay model and explaining the role of midwives in their communities. Advocacy for Safe Motherhood among youth, a committee of alliance in a new governorate, is among some of their other successes. Challenges for Yemen are limited administrative and financial capacity within the alliance, limited understanding of the concept of volunteer work, limited independent financial resources for the alliance. For Pakistan, successes include a grant which they have been recently awarded to promote magnesium sulfate as a norm for the prevention and treatment of eclampsia, local chapters in Punjab and Khyber Pakhtunkhwa provinces, a documentary on the importance of stillbirth attendance. The National Alliance in Pakistan is facing a challenge that is very different from many of our national alliances. The Federal Ministry of Health was recently devolved, so the health portfolio is now being managed at the provincial level. The White Ribbon Alliance Pakistan has been working to establish provincial-level chapters to ensure that maternal health remains a priority across the country. Other than that, continuity of vertical programs in the health sector, accessibility to health services, and availability of skilled birth attendants continue to be a challenge. For Bangladesh, we're very proud to share that we have recently commissioned an analysis of the national budget to understand the allocation of funds in maternal health. We have had several orientation sessions with key influencers for maternal health, parliamentarians, media, leaders of influence. We've had several talk shows highlighting priority issues for maternal health with policymakers, senior program managers, and lawmakers. We've identified key strategies to promote public sector accountability for maternal health. In challenges, we would like to mention that retention of skilled workforce for maternal and newborn health, while we continue to advocate for it, it still remains to be a challenge that how we bring it about. Keeping volunteers engaged in the work of the Alliance is also an ongoing challenge. For India, they have been amazingly successful in promoting social accountability at the grassroots level through public hearing, checklists to track availability of services at the health center, verbal and maternal death audits, working with media and elected representatives, mobilization on entitlements. systematic policy review and a subsequent design of a grassroots campaign on birth preparedness and complication readiness, and they have been able to engage 50 celebrity champions mobilized in promoting safe motherhood awareness. I would like to describe this picture first. It's a picture from a public hearing in India where the maternity services are supposed to be free if you go to deliver in a facility. Now, this woman actually took the microphone and asked all the women in the audience, how many of you have had a free delivery service from this facility? And none of them raised their hands. So government officials in attendance, it became clear to them that while good policies were there, these women were not being able to get the care that they're entitled to. Through the use of these tools, administrators and policymakers have been able to identify gaps and reaffirm or pledge commitments. Again, their challenges remain funding and sustainability, lack of support for social accountability programs, maintaining volunteerism, and finding technical assistance for the state alliances. Our alliance in Indonesia is a strong example of disseminating messages to ensure that girls and women are informed in order to demand health services they need. Broadcast partnership with Radio Republic of Indonesia, engaging the First Lady as a patron, social media and partnering with youth clubs, universities, and midwifery academies, health promotion program on clean and healthy behavior and safe motherhood in 5 provinces and 10 districts with the Ministry of Health. This is a picture from the Indonesian Youth Day, where APPI organized talk shows throughout the country with the theme, Young Generation and Safe Motherhood. And you see the young and the young at heart all sitting together to combat maternal mortality. Other successes include, in Indonesia, White Ribbon Alliance have been working very closely with the Ministry of Health on the Desa Siaga Alert Villages model. The Desa Siaga model is a comprehensive approach to meeting maternal health needs at the community level. It includes 1 midwife for every community, 4 community ambulances, a blood donor list, as well as educational manuals, monthly village forums, and outreach program for teenage girls. Their challenge is really geographical boundaries. Advocacy in 17,000 islands divided into 33 provinces, 560 districts, and more than 70,000 villages, which have their own priorities to political issues, not necessarily maternal health, is indeed challenging. Here's some pictures from different initiatives that White Ribbon Alliance Bangladesh has taken part in. And you can see by the picture in the bottom right, in the orientation session we did with the parliamentarians, we have 1 leader from the ruling party and a parliamentarian from the opposition party, united by their commitment to maternal health. Though the objectives and challenges of each national alliance vary to some degree, one thing we have learned across the national alliances is the importance of working in partnership, uniting diverse stakeholders, reducing the duplication of efforts, and sharing best practices, all to ensure that limited resources are used most effectively, and so we get the most out of all our partners who are working to put an end to the needless death of mothers and newborns. We do know how to prevent the needless death of women in childbirth. And now we're seeing it happen in more and more countries around the world. Ending maternal mortality can be done, and it must be done. I would like to end with a quote from the Women Deliver website. We need to break the silence around maternal deaths. To do that, we need your voice and the voices of your friends, families, and policymakers to send a clear message Invest in women. It pays. I would like to take this opportunity to thank each and every one of you from the bottom of my heart for all the good work that you keep doing and are doing to make sure that together we reach our goal. When women survive, families and societies thrive. Thank you, ladies and gentlemen.